when we talk about business continuity, it is not the responsibility of the CIO. It's not the responsibility of the people in information services. It's the business operators who use these systems, the clinical operators, the research operators. They have to understand the systems that they use and why they're critically important to their processes and what processes break when those systems don't work. And that's still a hard transition for us in healthcare to wrap our heads around.
I think in all the years we've done it, I've not disagreed with you much, but the statement of this is not the role of the CIO, I couldn't disagree with more. I agree with you that the business has to understand what are we going to do in the case of a situation and that kind of stuff, but they do not have the wherewithal to understand the flow of data, the contractual. This is why you have a CIO. John Halamka, in the last interview I did with him, he famously early on said the role of the CIO has changed totally, and we have that clip. The last time he was on the show, he said, the role of the CIO is gone. It's done. It's over. It's not needed anymore. And I was like, whoa, like, oh, slow down. But the reality is it's bifurcating at this point. You have the innovation side and you have the operational side. And my comment to him was like, who's going to do this? Who's going to do this? Who's going to do this? And he sort of relented and he says, yeah, all those things still need to be done. And part of that is the continuity. It's the keeping the systems running and making sure that you have good cybersecurity practices in place and all those things. And I understand that cybersecurity is the role of everybody in the health system, but putting those tools in place, putting those mechanisms in place, the responses in place. But sort of what you said is saying, we don't need a fire department because it's everybody's job to put out a fire, but we still need a fire department.
Yeah, I don't know if I agree with you on that. I mean, yes, I agree with you on the fire department part. What I mean is that when business or clinical or research leaders essentially abdicate their responsibility for business continuity and they look at the CIO and they say, it's your job to make sure that you know everything about our business so that if something breaks, your job is to help us get back up and running. I think that's a bad situation for health systems because it's a misplaced responsibility. I think business and clinical and research operators should strap on the reality that they live in today, the additional responsibility that they are information people now, that their business doesn't work without the flow of information through their operations. And they have a responsibility to know and understand what those information flows are and what systems are involved in those. And they have a responsibility to understand what breaks when those information flows are fractured and what their plan is to continue business or clinical or research operations when that happens. That really is their responsibility for running those parts of the business to make sure that they understand how they can keep taking care of patients and families.